Thank you all for coming. As Susan said, this is Fall Prevention Awareness Month, so I'm usually up here just talking to you all in September about what you can do to prevent falls at home for yourself and or your loved ones. Today, what I'd like to start with is just a conversation of people's experiences with a fall in this audience. Everyone has a fall. It's not something that just happens when we get older. In fact, falls aren't a normal part of aging, and we shouldn't think of them as such. I have fallen before. I was running, training for one of my triathlons in the dark, and running along, and what happened was the sidewalk had elevated a bit due to weather and things that happened that I didn't see. And I went flying forward, just like this, like Superwoman. I didn't feel so special or having extra talents at that moment. But I was able to brush myself off and keep on running. But that's me. I've had a fall experience. And I'm fairly certain many of you in this audience would be able to think of some time when you have fallen. And what we'd like to do today is just start out with making notes about places or situations where people have experienced a fall. Would anyone else like to follow my lead? Please.
Well, similar, we were at a restaurant and our car happened to park at the sidewalk and there was a hole in the pavement. When I stepped off, I fell, but I managed to just hit my knees because I caught the car so I didn't fall on my face.
Good, good.
But I did fall.
You did fall, yep, see? And I'm just going to take little notes about this, not the person, but just the situation, okay? So I'm going to, for myself, it's an uneven sidewalk. What's that?
Dip at the pavement.
That's what I'm going to say. Okay, uneven sidewalk. Dip in the pavement. Anyone else? Yes, sir.
I used to fall in the tub a lot, but then we got a walk-in tub, and that's taken that away.
Excellent, excellent, but very important to talk about those tubs. Yes, thank you for sharing. Anybody else? Yes, ma'am.
I have fallen a few times, and I learned by myself that I have to think before I move. Because we do things all of a sudden, like you turn around, you know, to think. If I know that I could fall, I go easily because I have back problems. I have to think what I do before, and that has helped me.
That has helped you.
Yeah.
But it does put an extra burden on your body that you're having to be really in high guard, always paying attention to not fall. Can you give me one instance of a place that you have fallen? Something that's caused you to fall?
I was in my house and I
Okay.
had a little lamp, candle.
Uh-huh.
And started getting fire in the patio. And then somebody pointed at me, you have fire in the patio. And instead of turning around, thinking, I went this way completely. Didn't think, I just went around like where?
Well,
Down.
I imagine with fire, all of us would have a quick reaction. So, yeah. So, well, I could put fire. Or turning around quickly. How about we write that? Because you were doing it quickly, correct?
Yes.
Okay. Not thinking. I'll put it there. Thank you for sharing. Karen?
Trip hazard, I tripped on a railroad in our house.
Yeah, that happens, absolutely. Thank you. Yes?
Caught my heel and slid down the stairs on my stairs.
Right, those stairs, absolutely, very much a part of some people's fear of falling. Yes, thank you. Yes. Hawthorne, have you had a fall experience that you'd like to share?
A few years back, slipped on ice.
Right, ice.
It was a slight slope,
Right.
pavement, you couldn't see.
Can't see it. Right, absolutely, thank you. That's a very good point. Place where I think a lot of people fall. And luckily, in Las Vegas, not something we think about often, right? But obviously in Hawthorne, other places in Nevada, for sure, it's a reality to them. Yes. Anybody else?
Don't
Yeah.
carry the right shoes.
Okay, yeah. What shoes are you concerned walking in?
Well, I don't wear leather.
Really?
carry
Okay, leather soles are
leather
slippery?
around. It has to be, proper.
Yeah, had wrong shoes
Soft,
on.
but not flat, Maybe boots are very good.
Okay. I'm probably getting pretty low here. Anybody else? Trevor?
I've fallen down the stairs as well.
There we go. See, times 2.
Times 2 on that one.
Yeah. Yes, sir.
Misjudging walking around furniture.
Okay. So tripping over like the leg of a table? Mm-hmm.
That has not moved, it's where it's always been. I guess this is for my wife.
Okay.
I guess, maybe not looking down enough and hooking your leg around that leg and then falling to the floor.
Yeah,
And I
absolutely.
wasn't home.
Okay, of course, right? Tub, and I'll bring it up here, you guys, but we'll also put furniture, tripping over furniture. Rugs, yes, yep. She did that too, huh? She's got lots of examples. Thank you. Very good. Welcome. Welcome. Yes, sir.
This might seem strange,
No.
but I have a mountain bike, and I ride a mountain bike. And when I had taken a class to ride the bike, you're supposed to fully extend your leg on the pedal
Okay.
from the seat.
Okay.
Well, I'm quite tall anyway. But when I lose my balance and I tend to want to stay on the seat, I cannot reach the ground because my feet are fully extended
On the pedal.
to the bottom of the pedal, which is about 3 or 4 inches from the ground. So the last time I fell was I lost my balance on the bike and had forgotten to scoot off the seat to gain my balance.
Sure. And did you fall right over?
Yeah, and you have no support.
No. I'm familiar with that one as well. I ride a bike where my feet are actually clipped into the pedals.
Right.
And I've had the similar experience. I know exactly what happened. I just can't get my foot out in time, right? You just can't get that foot down to the ground, and so you tip right over.
And you want to do the sport, you want to do it right.
Right. We might need to check out your form on that bike. Yeah, I'm going to put that down there. There we go, bike. Anybody else? Yes, sir.
My mom once fell getting out of an unfamiliar car. She knows how to get out of our
Your car.
But one time we were riding with my sister, and as she was trying to get out, her foot got caught, on the interior of the car,
Right.
and she went down.
Yeah, unfamiliar. You make a very good point. Anything that's unfamiliar seems to catch a lot of us off guard at times, right? We're often knowing things around us unless we're distracted, but unfamiliar areas definitely can get us. And car, I better put car there. Wow, this is a great list. And we all walked in here today, right? Most of us walking. We all have these stories. There is fall risk in all of our lives. It's just how often does it happen? And how able are we to recover from those moments? So today we're going to talk about the tips and tricks and making sure your fall prevention awareness is high and keeping us all as safe as we can be. And I'm lucky today to have one of my newest employees, my newest colleague, give the majority of this discussion. And this is Trevor Mahoney. He is the new physical therapist at the clinic, just graduated with his doctorate in physical therapy from UNLV this past summer, was able to do an internship with us. We fell in love immediately, and we're lucky to now have him on staff. So I'd like to share this Lunch and Learn today with him, and this will be his first time, so please help me give him a warm welcome.
All right, thank you, Jen, for that introduction, and thank you all for coming. Like she said, this is my first time kind of presenting as a full-fledged physical therapist, doctor of physical therapy, so you'll have to bear with me. I tend to be animated at times, so forgive the quirkiness about that, and forgive the hand motions. I like to speak with my hands, so I should probably just wave my hands up and down a couple times just to get it out of my system. But just like Jen said, we all have a fall story. But there's some things that we can do, not only do, but also know about, that can help us not let those falls affect our lives in a negative way. And that's what we want to talk about. So tips and tricks. So the tips are going to be things that we can know, things that we can store in our brain to help those instances not create a barrier in our lives. And tricks are the things that we're going to do. So I've got about two tips, about 5 tricks that we're going to go over today. So without further ado, let's start out with the tips. Not quite tips like you might get in the, from doing a service or something, but different types of tips. So the first thing is, I want you to be educated about falls. Now, why would this be important? You might ask yourself, why is it important that we need to be educated about falls? If you think about anything with falls, there's things that we might need to change in our lives in order to make it so we don't continue falling. And if you think about anything in your life that you would want to change, might be a good idea to know about what it is that you're trying to change, right? With knowledge comes power to change. And that's why we're going to talk about it. So I want to take some time to educate you about falls and the occurrence and how serious of an issue this can be if you're not already, very concerned about it enough right now. So we'll first define what a fall is. We'll go over some common myths that I hear in the clinic all the time, and we'll kind of talk about why they are myths and not facts. And then hopefully through this discussion, we can determine why exactly this might be an important topic for you to be educated about. So first of all, what is a fall? The World Health Organization defines a fall as any event where a person comes to a lower surface inadvertently that may or may not result in an injury. So you don't have to get injured in order for it to be considered a fall. Many instances that you shared up here might not have resulted in injury. Maybe a bump or a bruise. Maybe someone got cut. I know for my story, I fell down the stairs and I actually dislocated my shoulder. So that one did result in an injury, unfortunately, but they don't have to. So keeping that definition in mind, let's talk about some myths and some facts. These are fun. So I'm going to present a myth that I hear all the time, and then I'm going to present some statistics that have been done on falls within the United States. They're going to have some blanks in there, so I want your participation. So we'll start with the first one. So falls are not a big deal. I hear that all the time. It's not a big deal. Falls are not a big deal. I don't need to worry about them. Although it might not be a big deal to you right now, but let's talk about financially, how big of a deal this could be. So this first one, falls are the top blank most expensive medical conditions. So I want to hear, you don't have to raise your hand, just shout it out. How high do you think falls rank in this list of medical conditions as far as expense-wise? Anybody?
3.
Top 3, top 5, I'm hearing. First, it's actually top 20. So there are a lot of medical conditions that are more expensive than falls, but even falls are one of the most expensive. Let's move on to the next one. So how many $1 billion do you think was spent in medical costs associated with falls in 2013? For once, I saw $1 billion, I was just like, holy cow, that's a lot. But how many billion?
34.
We've got handouts here that people are looking at the notes and cheating. You're right, 34 billion. That's quite a bit of money. Not only out of our pockets, but out of the pockets of insurance companies, and then just the American people in general. So it's quite a substantial amount of money that's spent. Let's talk about average costs of medical costs in a hospital for a fall. How much do you think? Without looking at your papers, what do you think? 30,000? Pretty close. $35,000. So I'll go back to my injury. So as a result of my fall, I dislocated my shoulder. I end up having to go in for shoulder surgery for it. Probably cost close to about that much, just to get my shoulder fixed as a result of my fall. So let's go on to myth number 2. Other people fall, but not me. I hear that quite regularly. Miss Jane down the road, she falls, but I'm good. Or Joe, he's fallen quite a few times, but not me. I'm good. So let's talk about frequency of falls. How often people are falling in the U.S. So one out of how many older adults do you think fall each year?
You did?
I kind of gave you the answer.
Got it.
3? Good. It is 3. So look to the person to your right. Look to the person to your left. So there you go. So statistically speaking, if you look at side to side, one of you are statistically speaking going to fall in the next year. So that's quite a few people falling each year. All right. How much? If you add up all the falls that occur within the year, how many do you think it is?
Too many.
Too many?
Too many.
Too many. I thought you said 2 million. Well, you're in the millions at least.
2 million?
Anybody else? Any ideas without looking at your paper?
13 million?
13, 12? It's actually 35 million. Over 35 million falls that occur each year. So quite a few people falling. All right, let's calculate that into how many every second, or how many seconds do you think a fall occurs in the older adult population? Any ideas? How many seconds?
13 seconds.
I'm hearing a 13. He's absolutely correct. Give him a gold star. So I've probably been talking for about, 10 minutes now? So in the 10 minutes that I've been talking here, probably 40 falls have occurred just in the time that I've been up here standing. So to say that you're not falling is a great thing. But statistically speaking, the older population falls more. So we just want to bring that to your awareness that even though you're not falling now, you might fall in the future. So let's talk about this one. Falling is part of aging. I hear people come into the clinic, and Jen mentioned this before, that I'm getting older. It's just a part of aging. There's nothing that I can do to prevent this. And that is 100% false. And that's one of the take-home messages that I want to present to you, that aging does not equal falls. Just because you're getting older, your body's getting more frail, it doesn't mean that you have to be falling. And that's one of the things that I want to reinforce is there's things that you can do to prevent these falls. Myth number 4. It's okay that I fall. I bounce easy. I hear this all the time. People come into the clinic and they're just like, oh, I fell, but it's not a big deal. I didn't get injured. It's not a big deal to me. I just hop right back up and keep going. And I say to them, well, that's great. That's great that you're not getting injured. But what are you doing to prevent further falls? Oh, nothing. And that's where the problem lies. So let's talk about why it's not okay to keep falling even though you're not getting injured. So 1 in how many falls do you think ends up in a serious injury?
2.
Here it is, 10, 2 in 10. So if you've read, there you go, 10. 1 in every 10 falls. So statistically speaking, if you've fallen 9 times, the next time might be the time. But I don't want you to think that way. I want you to think that, okay, my next fall could lead to a serious injury. So there's something I need to change today so that next fall doesn't become that one. It only takes one to cause a serious injury that leads to a cascade of events downwards. All right, how many million falls do you think we're seeing in the ER in 2013? What do you think? Without reading, any ideas? Shout some answers out.
2.5 million.
2.5 million. Attaboy, there we go. He just had to shout it out. So 2.5 million. So that's a lot of visits to the ER, just for falls alone. So of those 2.5 million, how many of those do you think were actually admitted into the hospital? Meaning that they had a serious enough condition, or they actually had to stay a little while? What percentage? Hearing a 10%? 50? 100? It's actually 29%. So not all falls, like I said, result in a serious injury, but 29% of them actually ends up in a serious enough condition where they have to stay overnight in the hospital. No guesses on this slide, just because it's not a fun topic to talk about, but these are the common injuries that can result from a fall. So things like a traumatic brain injury, or hip fracture is a very common one, or a wrist fracture. You think of someone falling over, they go to brace themselves, they break their wrists. As well as lacerations. You're falling up against a sharp corner of a table or something, you get a scrape or a bruise, or even hitting your head and getting a little laceration on your head. All of these are common injuries that result in as a result of a fall. Kind of a sad thing to talk about, but something to be aware of is that you look at this graph, deaths as a result of a fall. And you see this graph here. It's just slow. It's not a slow progression, but it's quite the big spike of deaths that are occurring as a result of a fall. So to say that, it's okay that I'm falling because I bounce easy, well, if that's resulting in a brain injury, it only takes one fall to hit your head, and just think of the consequences that could possibly happen. And that's why it is a big deal, not only money-wise, but just it's something to be educated about and to take those steps to prevent further falls. This is one of the things that I wanted to point out. So this gentleman back here talked about he fell on his mountain bike. I'm sure that didn't feel good, correct? That fall on the bike probably didn't feel good. It resulted in pain. And sometimes we get into this cycle of when we're doing something, say you're going to the store and you end up falling in the store. The store, they're tile floors, they're hard. You might have a lot of pain as a result. Anytime we fall and we have pain, there might be a fear that is associated with that pain, where we build up a fear of, I rode my bike, I fell on my bike, therefore, maybe I'm gonna be afraid to get back on my bike again, or I'm afraid to go to the store because that's the only time I fell. And that's where you enter this vicious cycle where you stop doing those activities that you enjoy doing, like biking, or you enjoy going to the store, but you stop because you fell there once. You reduce your activity. It's shown as you reduce your activity, you actually become at an increased risk of falling, and therefore fall again. And so you enter this vicious cycle that it's hard to get out of when you fall. So to say that it's okay that I'm falling now, you might not recognize it now, but you might be decreasing your activity level, which then can put you at an increased risk of falling. So it's a vicious cycle that we want to put a stop to by reducing our fall risk. So let's go to tip number 2. So I just gave you a lot of information about falls. And tip number 2 is to know your fall risk. So how do you determine your fall risk? What does that mean? Well, I want to just take a moment and let's assess it right here, right now. So I want you to, on everybody's chair, you should have gotten a piece of paper that looks like this one right here. Has question 1, 2, 3 on it, picture of someone standing, and then some different feet poses. So we're going to answer 3 questions. So if you have a pen, go ahead and pull it out. I want you to answer these 3 questions. So question number 1 is, there's some pens. Anybody not have a pen? You can get pens handed out. So question number 1, just circle yes or no. Have you fallen in the past year? Just take a moment, circle yes or no if you've fallen in the last year. And then if you marked yes really quick, just write down how many times next to it and were you injured. So So number and then a yes or no to that. So that's all question number 1. So question number 2. When you're walking or even just standing, do you feel unsteady? Do you feel unsteady on your feet? Go ahead and circle yes or no. Okay, question number 3. Do you worry about falling? Just quickly circle yes or no for question number 3. All right? Let's explore fall risk further. So I wouldn't be a good physical therapist if I didn't make you at least move a little bit while I'm presenting, right? So anybody that would like to participate in exploring their fall risk further, we're actually going to do this sit to stand test. So 30 seconds. So anybody that would like to participate, go ahead and set down your stuff. And I want you to come to the middle of your chair. Okay, so come right to the middle of your chair. And I'm going to have you cross your hands right across your chest. So you're going to look just like this picture up here. I'm going to come down, arms across your chest. And I'm going to start a timer. Oh, where's my timer? My timer did not show up. You got me covered?
Yep, I got it.
All right. So we're going to stand up as many times as you can without using your hands for 30 seconds. Okay, so I want you to count. How many times you can stand up. If you use your hands, you can't count that one. So without your hands. Ready? 30 seconds. I got my timer right here.
Yeah.
All right, and go. 1. I guess I can't count everybody's. Count them in your head. Make sure you're coming all the way up and all the way back down. Where are we at, Jen? 14, 15, 16. There we go. Good.
25. 6. And stop.
And stop. All right. So on that paper, right next to that, write down how many times you were able to stand in those 30 seconds without using your hands. Keep in mind that you had to come all the way up and then back down to count it. So if you only were able to make it part way up, doesn't quite count. Okay? So write that down. And then after you write it down, let's go to this chart here. This is test mainly for the older population. So if you're younger than 60, we'll just go by the 60 age group. But so look at your age up here on the left-hand column. And if you're male, you're going to go that second column, and female, that third column. So if I were, say, 60 years old and I was able to stand up 14 times, I would be above average. But if I was only stood 13 times, I would be below. So I just want you to write next to your time if you were above or below. I'll give you another example. So if I was 82, and if I were female, which I'm not, but if I was able to stand 9 times, then I'm above. If I stood 8 times or below, then I was below. So right above or below. All right. Now the next thing I'm going to have you do to explore your fall risk. Now if you're unsteady on your feet, I'm going to use my professional opinion that maybe consider yourself to not do these next activities, but we're going to be standing in 4 positions for 10 seconds. They're right here on your sheet. So one is feet together, and then slightly apart, heel to toe, and then on one foot. So anybody that would like to participate, you can go ahead and stand up. If you need a little extra balance, I would encourage you to use a chair in front of you. For the people in the front row, that might be a little difficult. I could give you a chair if you would like. But I'm going to emphasize, please do not fall during a falls prevention presentation. It's not going to look good on my resume. There we go. Okay, so the first position I want you all to get in, you can hold onto the chair if you're feeling unsteady to start off with and bring your feet all the way together. Okay, hopefully these, oh, perfect, my timer's on these ones. All right, so feet together, and we're gonna stand here for 10 seconds. So as soon as I start the timer, let go of the chair if you're holding on. Ready? Go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and time. So if you're able to stand the whole time, great. If not, that's okay. Just make a note how long you're able to stand. And we're going to go to the next position. So slightly stagger your feet so that the instep, the big toe is in the middle of your foot there. Okay? And we're going to stand here for 10 seconds. Ready? Go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and time. Good. So let's move on to the next one. If you had a hard time with that one, we're only getting more difficult from here. So we're going to go heel to toe. Heel to toe. This is probably the most difficult one so far. So heel to toe. Once again, I'm going to emphasize, do not fall. Use a chair in front of you if you need it. So going heel to toe and begin. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, good. And the last one, standing on one foot. Probably the most difficult one as of yet. So if those other ones were very difficult, this one's probably going to be more so. So we're going to have you stand on one foot. You can use the chair in front of you to help bounce out. But once again, please do not fall. And we're going to go for 10 seconds. Ready? Go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. All right. So go ahead and have a seat. And if you were able to stand in all 4 positions for the full 10 seconds without holding on, that's great. But I just want you to make note of the one that, so the furthest one down that you were able to stand for 10 seconds without holding onto the chair or putting your foot down or moving positions. Just make note of that. So what does all this mean? Now that we've kind of gone through these exercises, what does it mean? So we'll start with the 3 questions. The 3 questions that we answered before. If you have fallen in the last year, or do you feel unsteady, and do you worry about falling? If you answered no to any of these questions, you are most likely at a low fall risk. Most likely. You're probably at a low to moderate, depending on how you did on the test. But probably a low fall risk. If you answered yes, we'll go to the test that we did. Okay? If you answered yes to some of those questions, to any one of those questions, but you were above the age range norm for your age for standing up and sitting down, and was able to stand for 10 seconds heel to toe, then you would be considered at about a moderate fall risk. Okay? However, if you were performed below and answered yes, then you're probably at a high fall risk. The reason why it's important to know your fall risk is because now you know how much do I need to start changing now in my life so that I can prevent further falls. All right? If this wasn't a setting where you feel like you got a good assessment, there is actually a Falls Prevention Awareness Day that is on September 23rd. And actually here at the LouRuvo Center for Brain Health in the Event Center, we are doing a free fall risk and memory screening. I believe you all got a flyer on that. Last I heard, there are still some spots available. It has on there the website that you'll need to go to, or the phone number that you need to call to register for that. So there we'll assess your fall risk further and give you further details on what you can do to decrease your fall risk. So it's 1 to 4, it's right after the Lunch and Learn on that day here at the Event Center, and everyone is welcome. So anyone can sign up. So just to give you another resource if you want further exploration into your own fall risk. So let's move on to tricks. We're done with the tips. Let's move on to the tricks on what you guys can do to further prevent fall risk. So trick number 1 is tell your fall stories. I'm glad Jen came up and had some people share about their falls because that's really the first step to preventing further falls. And I'll tell you one of the reasons why. So when we tell our fall stories, hopefully with the person that you're telling them to, with either a healthcare provider, a family member, or a friend, we can discuss with them details and events that led up to the fall. Was it, were your pedals when you were biking, were the pedals too low, or going on the ice back in Hawthorne, did you not have proper footing, or could you just not see it? What were the things that were associated? Did you have to get up in the middle of the night to go rush to the bathroom because you have urgency to get to the bathroom at night and there just wasn't good lighting? Was that one of the things? Or throw rugs. Rugs was mentioned as well. Is that you keep catching the edge of that rug. What were the things that precipitated the fall? As you talk about those things, you can have a good discussion with the person that you tell your story with, what you could have done differently to prevent that fall. Maybe it's time to roll up the rug, and it might be a family heirloom, but it's time to roll it up and put it under the bed because it's causing you to fall, right? Or maybe we just need to put a nightlight in so that if you're getting up in the middle of the night and having to go somewhere, you can have good vision. All these things you can discuss. And then you can discuss what you can do differently from now on. So after you tell your fall story, it's good that you can tell your fall story. I know some people are afraid of telling the fall story because they might think, that's embarrassing, for one. And two, they might, if you tell someone, they might take the car keys, or they might, decrease your independence. But really, it's a good topic to talk about so that you can discuss with them and come up with ways and things that you can do differently to prevent further falls, so that you're not making the same mistake twice. So I'm not falling down the stairs multiple times. All right, trick number 2 is going to be go see your eye doctor. Obviously, if you have vision like these pictures up here, it's definitely time to go see the eye doctor. But why would that be important for preventing falls? Well, as we age, our eyesight gets worse. And eyesight and vision is one of the most key components of our balance. It's one of the 3 main systems that contributes to our balance. So it's very important. So as vision decreases, so does balance. So it's important that we go see the doctor or the eye doctor at least once every year. Get your eyes checked. Now I have on here bifocals and trifocals. Why would that be a topic of discussion? I'm going to go to this gentleman's response here about the furniture. I don't know if he wears bifocals or trifocals, but I could imagine if you're trying to navigate furniture and you're just looking down through that bifocal, it's not prescribed to be seeing things at that distance. So it might be easy to miss. It might be blurry, or any obstacle below, or even going downstairs. A couple of people, I fell downstairs. It wasn't due to bifocals, but going downstairs, and if you're looking down through that bifocal or trifocal, it might not give you the clarity that you might need to have good balance. So it's important to have that assessed, and maybe it's time to talk to your eye doctor about getting a pair of glasses specifically for reading and a pair of glasses specifically for regular moving around your daily activities. Would be my recommendation, and kind of a trick to prevent falls as a result of falls. Yes?
I would think trifocals would be more and more important for reading computer screens.
Most definitely. So I'm not educated as far as the trifocals, but it might be a topic of discussion for the eye doctor when you go visit.
Well, in that situation that you're sitting, so that might be something that helps you navigate that computer screen more easily. But then taking those off for when you stand up and move around your home, they're not good when you're walking.
Yep.
But I agree that there's some benefits to them for sure.
So we had just for the Hawthorne campus, we had a lady mentioned that trifocals will be good for computer screens, which when you're sitting at a computer, you are sitting, not as mobile. And so, although it might help with the computer screen, it might not be as appropriate for moving around, navigating. Trick number 3 is go to the doctor to have them review your medications, or a pharmacist. The reason why this is important is because there's medications out there that significantly affect our fall risk, that increase it. Also, if you're taking more than 4, we call it polypharmacy. If you're taking more than 4 medications, it's shown in the research that you're at an increased risk of falling. So maybe it's, if you haven't had a doctor's appointment where you've had them really go through and comb through your medications, maybe it's time to go back. Have them look at specifically drugs that affect your mood or your sleepiness. Those are type of drugs that you might need to have them look at and see if they can find other substitutes that might not affect the fall risk, because tricyclic antidepressants, antipsychotics, benzodiazepines, they're the ones that are shown to increase your risk of falling. Trick number 4 is make the needed home modifications. We've kind of hit home the throw rugs. Anything else here? Furniture. You know, if you have furniture like an ottoman or something that you keep tripping on. Also, things like pets. Pets get tangled up under people's feet all the time. Increase your risk of falling. So maybe having them in a separate part of your house if you are going to have them. Rugs, having improper lighting like I mentioned before, or if you're just not picking up after yourself, if you have a lot of clutter, or if you're putting magazines or newspapers on the ground, can definitely create a fall hazard. So time to maybe look at your environment. If you're constantly tripping over something, maybe it's time to move that lamp or that cord somewhere else. Exercise number 5. Probably my favorite. Exercise. I could talk blue in the face to get people to exercise. But oh, how important it is. So briefly, let's talk about exercise recommendations. I know we're kind of running short on time. We're good? Okay. So people might think, you know, I'm at a fall risk and it has to do with balance, right? So all I need to do is add balance exercises and I'm good. Although that might work for some, not for everybody, and definitely not the best approach. You need a well-balanced exercise regimen, because you can't have balance without stability. Stability comes through strength, so it's important to have strength training. So here's some exercise recommendations that the CDC gives us that's shown to help not only improve health, but also decrease fall risk. So having that good aerobic exercise component. So you're not getting fatigued. You know, if you're walking up the stairs, not getting as fatigued. Exercising, try to go 30 minutes a day, 5 days a week. Getting that heart rate up. Doing things that you enjoy doing, such as, you know, this gentleman enjoys biking. Go out biking if it's safe and appropriate for you. If you enjoy swimming, get out in the pool. If you like just being in the water and have a hard time walking on land, walk in the pool. It's a great exercise. Anything that you can do to get your heart rate up. So strength training I mentioned before. In order to have good balance, you need to have the muscles to support you. So it's important to exercise those muscles at least 2 times a week, focusing on those big muscle groups that can help create the stability that you need to have the balance. And then you can incorporate the balance exercise. Doing the balance, so some easy balance exercises that we just even did today. Standing up and sitting down from a chair. Sitting down from a chair. Sitting down to a chair. Staying up and sitting down without using your hands. You might not think it's a balance exercise, but you think if you tried to control that descent down, how much balance it takes to not kerplop and just do a crash landing down to your chair. It can be a balance exercise as well as standing in those positions, both feet together, staggered, heel to toe, and 1 foot standing. Those are all examples of balance exercises that we can add into our regimen. And then stretching. If our muscles are too tight and don't have the flexibility, we might have abnormal postures that put us at an increased risk of falling. All too often we find people in this posture which carries weight forward. If you carry that weight forward, it puts you at an increased risk of fall. So having good flexibility in your muscles. So adding that stretching component to your exercise is also a good idea. Now, if with those resources you're still not sure how to go about exercising, there's other resources that have been shown in the research to significantly decrease your fall risk. Programs like Stepping On, Tai Chi, Moving for Better Balance, Matter Balance, and Otago Exercise Program. These are all programs that have exercise as a component of them that have shown to significantly decrease your fall risk. I'll specifically talk about Stepping On for a moment, because Just recently, the physical therapist and occupational therapist, the rehab department, just got certified to be stepping on leaders. So we are actually going to be hosting some of these stepping on classes. It's a multifaceted program where you have a lot of a group discussion, where we exercise, we'll tell false stories, we'll go over different things, we'll bring in expert guest lectures, people like optometrists or ophthalmologists to go over site. We'll have a pharmacist come in to talk about medications, as well as community safety experts that can go over moving safely in the community. So it's a multifaceted program. Now, if you're interested in, and it is free, if you're interested to lower your fall risk, we're going to start classes in October. If you're interested in that program, to participating, it is 7 weeks, 2 hours a week with a 3-month follow-up. So it does take a little bit of time commitment because that's 14 hours over the course, but every week for 2 hours. So if it's something that you feel like you can commit your time to, please sign up for the fall risk screening on the 23rd, because that's where we're going to pull from that screening. That's where we're going to pull the members of that class. But we'll be doing these about once or twice a year.
How do we sign up, Trevor,
For the fall risk screening,
for the stepping on class?
so go to the fall screening on the 23rd.
Okay.
Go to the fall screening, and from there, we'll assess fall risk, and those that we feel need it the most, we'll try and get the list from there. Does that make sense? Okay, so that's a great program to help decrease fall risk. So just in summary, just to go over the tips and tricks that we've discussed. So first, be educated about falls, and then know your fall risk. And then tricks, be sure you're telling your fall stories. Go to the eye doctor at least once a year. Review those medications with your doctor or pharmacist. And if there's anything in your home that are fall or trip hazards, make those modifications to make your home a safer place. And then exercise. All right? Thank you. Any questions? That's all I have. Hawthorne, do you have any questions?
No thanks.
All right. Any other questions? Yes.
First of all,
That was very, very well presented, thank you.
Oh, you're welcome.
you did do very well, so.
Thank you.
But a comment, I work with a lot of clients who use walkers and wheelchairs, and you see them, their walkers too far out in front of them, or they forget to lock their wheelchair when they're sitting down and they miss the chair. So that's where they need the physical therapist to help them out. Instruction on using those.
Thank you for that comment. Just to reiterate that comment, she said she works with a lot of people that use canes or walkers or wheelchairs that either don't lock the wheelchair when they stand up or they're moving away from them. So just need to be, or they're getting their assistive device too far out in front of them. So it's always good to remind, if you have family members or if yourself using an assistive device, make sure you keep it close, so you're staying inside that safe range where you're using it to its full capabilities. Thank you.
Trevor, once we're in the process of a fall, do you have any suggestions to minimize the injury of the fall?
That is a good question. So she asked if you're in the process of a fall, what things can you do to prevent injury? The first thing that comes to mind is tuck and roll. Tuck and roll. Instead of trying to brace yourself, it's always good to try and curl up a ball and let your body just kind of roll off of it instead of coming to a hard impact. Just being able to tuck your body so that it's not a hard impact, but a soft kind of roll on the ground is a great strategy for preventing injuries as a result of the fall. Yes?
I'm very thankful in my younger days, when I was in high school or in junior high, we took a phys ed course, and we learned how to fall, doing, different types of falls and stuff. That's still easy today.
Yep, most definitely. The gentleman just made a comment that back in his younger years in high school, he learned how to tuck and roll and how to do that fall. And he's been using it to this day, so that's a great strategy to use. Great. Any other questions or comments? Yes, here in the back.
If somebody has an eye test where it's like the letters, can you see this far away, and they're fine vision-wise that way, are there other eye problems that someone could have that can contribute to a balance issue?
Most definitely. So it's not just decrease in vision that can affect it. There's other eye conditions. Just off now my mind's going blank, but just different neuropathies, having cataracts can definitely affect it.
So even if they don't seem to have trouble seeing, it still merits maybe having
Yes.
screening.
Yep. Exactly. You had a question here.
I guess that tuck and roll wouldn't always apply.
Not if you fall on your back.
But my wife says that she has estimated that she's reduced the amount of injury by maybe 50% by bracing.
By bracing.
It happens a lot when I'm not home, or and I try to get all the details from her when I get home to try to prevent next time. But I want to know what happened and know what's been hurt this time.
Right.
And she'll tell me that she thinks she reduced it by 50% by bracing.
By bracing. So this gentleman just made a comment that his wife feels that she has reduced her injuries that result in a fall because she does brace. I mean, if you're finding that if you can brace yourself on like a wall or something, I can see how that could lead to lower injuries because you're not coming from a higher surface.
You're slowing it down.
You're slowing it down a little bit, but definitely bracing. I mean, you're going to have to brace a little bit at the beginning to get it, but then it's good to not let fall on an outstretched arm where it's stiff, but have a little bit of impact and then try and roll off of it instead of just taking all the brunt of the force.
My experience is the opposite. Back in the days when I was skiing, and I just relax when I fall, I don't get hurt.
This lady just made a comment that when she was skiing, she tried to relax as much when she fell so that she could reduce that chance of injury. She didn't get injured when she relaxed rather than stiffening up. Yes.
We're adding tips. My son's in jiu-jitsu and they teach them to fall. They say the number one thing is bring your chin to your chest because that can help you from those head injuries that can cause so much damage.
So yeah, the lady just mentioned that her son does jiu-jitsu and they say to tuck the chin anytime you're falling so that can help reduce the load and strain that comes from the impact. Thank you. Anything else? Thank you. All right, thank you.